Diabetes mellitus type 1 T1DM is an metabolic disease, autoimmune condition. Look at this picture, shows that healthy pancreas and diabetic pancreas and disease mechanisms, detail going on. Introduction. Diabetes mellitus type 1 is a chronic autoimmune condition where the pancreas produces little to no insulin due to destruction of insulin producing beta cells. It typically manifests in childhood or adolescence but can occur at any age. Definition. Diabetes mellitus type 1 is a chronic autoimmune disease characterized by the destruction of the insulin producing beta cells in the pancreas. This destruction results in a severe insulin deficiency. Leading to elevated blood glucose levels, hyperglycemia, unlike type 2 diabetes, which is often associated with insulin resistance and lifestyle factors. Type 1 diabetes is primarily due to autoimmune response where the body's immune system attacks its own cells. This condition typically manifests in childhood and adolescence but can occur at any age. The lack of insulin production requires lifelong insulin therapy for glucose regulation and metabolic control. Types 1. Idiopathic type 1 diabetes. No known cause, rare, mostly in people of African or Asian ancestry. 2. Immune-mediated diabetes. Most common type caused by an autoimmune response. Causes. 1. Autoimmune destruction. The body's immune system mistakenly attacks beta cells in the pancreas. 2. Genetic predisposition. Family history increase the risk. 3. Environmental factors. Viral infections such as enterovirus, early exposure to cow's milk, and other dietary factors. Risk factors. 1. Family history of T1DM. 2. Genetic factors. HLA DR3 or HLA DR4. 3. Presence of other autoimmune conditions, example thyroid disease, celiac disease. 4. Certain viral infections. Complications. 1. Short-term diabetic ketoacidosis, hypoglycemia. 2. Long-term cardiovascular disease, neuropathy. nephropathy, and retinopathy. Pathophysiology. The autoimmunodestruction of pancreatic beta cells leads to insufficient insulin production. Without insulin, glucose cannot enter cells and accumulates in the blood, resulting in hyperglycemia. The lack of glucose in cells leads to energy production through alternative pathways, causing ketone formation and possible ketoacidosis. Steps or process. 1. Genetic predisposition. 2. Environmental triggers. 3. Autoimmune response. 4. Beta cell destruction. 5. Insulin deficiency. 6. Hyperglycemia. 7. Glucose and ketone metabolism. And 8. Symptoms and manifestation. Signs and symptoms. 1. Polyuria, frequent urination. 2. Polydipsia, excessive thirst. 3. Polyphagia, increased hunger. 4. Unintended weight loss. 5. Fatigue. 6. Blurring vision. 7. Frequent infections. 8. Slow healing wounds. Diagnosis. 1. Fasting plasma glucose FPG more than 126 mg per dl. 2. Random plasma glucose more than 200 mg per dl with symptoms. 3. HbA1c more than 6.5%. 4. Oral glucose tolerance test OGTT. 2-hour plasma glucose more than 200 mg per dl. 5. Autoantibody test. Presence of insulet cell antibodies ICA, GAD antibodies, etc. Nursing diagnosis. 1. Imbalanced nutrition less than body requirements. 2. Risk for unstable blood glucose level. 3. Risk for infection. 4. Knowledge deficit related to disease management. Management and treatment. 1. Insulin therapy, basal bolus insulin regimens, insulin pumps. 2. Blood glucose monitoring, regular self-monitoring, continuous glucose monitoring, CGM. 3. Diet and exercise, carbohydrate counting, balanced diet, regular physical activity. 4. Education, understanding the disease, insulin administration, recognizing symptoms of hypo or hyperglycemia. Psychosocial medicine. 1. Coping with chronic illness. 2. Addressing stress and emotional well-being. 3. Support groups and counseling. Prevention. Currently there is no known prevention for T1DM. Ongoing research aims to identifying potential interventions. Here are some areas of focus on potential preventive measures under investigation. 1. Genetic counseling. 2. Immunotherapy. 3. Environmental modifications. 4. Beta cell protection. 5. Early detection and intervention. 6. Diet and lifestyle modification. In conclusion, diabetes mellitus type 1 is a manageable condition with appropriate medical, nutritional, and psychosocial support. Understanding the pathophysiology, symptoms, and treatment options is crucial for effective management and improving quality of life for those affected. Thank you. Have a wonderful day.